Hello everyone, today we'll learn a new system in our body, the urinary system. In this chapter, you are required to master the composition of the urinary system. Composition. Kidney generate urine, excrete most of the waste produced by metabolism in form of urine. Ureter, the passage of urine from the kidneys into the bladder. Bladder stores urine. Urethra, the pathway for urine excretion. First, let's focus on the morphology of the kidney. It is bean-shaped and is about 10 centimeters in length, 5 centimeters in width, and about 4 centimeters in thickness. The upper end of the kidney is wide and thin. The lower end of the kidney is narrow and thick. The anterior side is more convex and faces anterolateral. The posterior side is more flat and above the ventral posterior wall. The lateral edge is convex. The medial is depressed, with renal vessels, lymphatic vessels, nerve cells, and renal pelvis in and out, called the renal hilum. First, let's learn the renal pedicle. The structure entering and exiting the renal hilum is collectively called the renal pedicle. The arrangement relationship from anterior to posterior, renal vein, renal artery, renal pelvis. From top to bottom, renal artery, renal vein, and renal pelvis. Next, renal sinus. The renal hilum extends into the renal parenchyma, and the lacunae surrounded by the renal parenchyma contain renal artery branches, renal vein branches, calyces, renal pelvis, and adipose tissue. First, let's talk about the renal cortex. It is located in the superficial layer, is highly vascular, and extends into part between the medullary renal pyramids, called the renal column. Second, renal medulla. The renal medulla is located in the deep layer and is composed of 15 to 20 renal pyramids. The base of the renal pyramid faces the cortex. The tip is blunt and faces the renal sinus, called the renal papilla. 2 to 3 renal pyramids synthesize a renal papilla. There is a papillary hole at the top of the renal papilla. The urine formed by the kidney flows from the papillary hole into the calyx. The calyces are funnel-shaped, about 7 or 8 encases the renal papilla. About 2 or 3 calyces synthesize one renal calyx, and 2 or 3 renal calyces converge to form the renal pelvis. Location of the kidney. The kidneys are located in the retroperitoneal space, on both sides of the spine, and against the posterior abdominal wall. The right kidney is lower than the left kidney, lower in women than in men, and lower in children than in adults. Position. Left kidney. The upper end is of the height of the upper edge of the 12th thoracic vertebra. Lower end is of the height of upper edge of 3rd lumbar vertebra. Right kidney. The upper end is of the height of lower edge of 12th thoracic vertebra. The lower end is of the height of the lower edge of the 3rd lumbar vertebra. Renal hilum is about the height of the 1st lumbar vertebra and 5 centimeters from the midline. Renal region. The region between the outer edge of the erector spinae muscle and the 12th rib, also known as the spinal costal angle. Now let's talk about the renal capsule. The renal capsule can be divided into fibrous capsule, adipose capsule, and renal fascia. First, let's talk about the fibrous capsule. It attaches to the renal surface, thin and tough, and is easily separated from the renal parenchyma. Next, adipose capsule. It is adipose tissue outside the fibrous capsule and plays a protective role in the kidney by elastic pad. Renal fascia. It is outermost layer and is divided into anterior and posterior layers, encases the adrenal gland upwards. Now let's talk about the ureter. Ureter is an elongated muscular tube and is about 25 to 30 centimeters in length. It starts at the lower end of the renal pelvis and ends in the bladder. It can be divided into three parts: abdominal part, pelvic part, and intramural part. First, abdominal part. This part starts from the lower end of the renal pelvis, anterior to the psoas muscle, descends posterior to the peritoneum of the posterior abdominal wall. At the entrance of the pelvis minor, the left side crosses the common iliac artery, and the right side crosses the external iliac artery into the pelvic cavity. Next, pelvic part. It arises from the pelvic inlet to the upper outer corner at the bladder base. First, descends along with the lateral pelvic wall posteriorly, then passes through the vascular nerve surface of the pelvic wall, enters the upper outer part of the bladder base anteriorly at the level of the ischial-spine. In women, it crosses with the uterine artery 1.5 to 2 centimeters lateral to the cervix. The uterine artery is anterosuperior, the ureter is posterior inferior. In men, there is a vast differences crossing its front. Next, intramural part. Obliquely penetrate the bladder wall inward and downward from the upper outer corner of the bladder base and open into the bladder. It has three strictures. The first one, origin of ureter, transition between renal pelvis and ureter. Second, intersection with iliac vessels through the upper orifice of the small pelvis. Intramural part. And the three strictures are easily retained sites of ureteral stones. This picture we can see the stone in ureter and three strictures in the ureter. Now let's talk about the bladder. The bladder is a muscular cystic organ and stores urine. Its shape, size, and location vary with urine filling. The capacity is about 300 to 500 milliliters in adults, and the maximum capacity is up to 800 milliliters. Bladder is prismatic when it is empty. Location. When it is empty, it is located in the pelvic cavity of a small bone. The bladder tip does not exceed the filling of upper edge of public symphysis. When it is full, it may exceed the public symphysis. And in children, the bladder is higher than that of adults. For most newborns, it is located in the abdominal cavity. The location gradually decreases with age. Adjacent. The anterior is the public symphysis. The posterior in men is the seminal vesicle, ampulla of vas deferens and rectum. In women is the uterus and vagina. The inferior in men is prostate, and in women is urogenital diaphragm. Superior. In men is the small intestine, and in women is below the uterus. First, let's talk about the bladder apex. Is toward anteriorly superior, and bladder base is triangular toward posteriorly inferior. Bladder body is between bladder apex and bladder base. Bladder neck is in the lower part of bladder. In men, it contacts the prostate, and in women, it contacts the urogenital diaphragm, and there is an internal urethral orifice. Bladder triangle. The area is at the base of the bladder between the urethral orifices on both sides and the internal urethral orifices. Due to the lack of a submucosa, whether the bladder is distended or contracted, there are no mucosa folds. Bladder triangle is predilection site for bladder tuberculosis and tumors. Intraureteral fold. The transverse fold between the two urethral orifices. The transverse smooth muscle bundles in the deep surface of the mucosa. It is a marker for finding the urethral orifice during cystoscopy. Bladder lobe. In adult men, anterior inferior part of bladder triangle, posterior to internal urethral orifice, with slightly convex longitudinal elevation formed by middle lobe of prostate. That's all. Thanks for your attention.